The trans fat. In the classification of triglycerides, we have differentiated saturated from the unsaturated, and at this time we will focus on the trans fat and the omega-3. Now, trans fat is a food additives from a processed food, and this is achieved by hydrogenation or partially hydrogenation through the use of catalyst. It is where the liquid oil can become semi-solid and be added to the food. Now, if you will look down below, there is a chain of fatty acid of the unsaturated nature, and you may see that there is a double bonding of a C to C bond that makes the straight chain be broken, be kink. And this is normal in an unsaturated fatty acid. However, in a saturated fatty acid, there is a single bond between a carbon to carbon. And in an unsaturated fat, there happens the double bonding between a C to C carbon chain. And what is remarkable about this double bonding of unsaturated fat is that this is so called as the cis bonding of the covalent bond between carbon to carbon. And if you may notice, the double hydrogen is being formed on the upper side chain of the fatty acid, and they are occupying the same side with nothing is left at the lower side chain. And that makes a difference between saturated and the unsaturated, from which the cis covalent bonding is said to be normal. However, the problem sets in if there will be a double bonding that is said to be trans fat in nature. The difference between the cis and the trans fat is that the hydrogen formation has been separated. As you may notice from the cis, the hydrogen is on the upper side chain, whereas in the trans fat, the hydrogen is located on the opposite side. One is on the upper side chain and two is on the lower side chain. And there sets the problem in trans fat. As I've mentioned, trans fat is an additive in the processed food. Now the question is, why do they have to add trans fat? This is in order to make the products to become desirable when it comes to firmness, the texture, and to have a palatable taste. And this is what we are usually seeing in the fast food and in the restaurant. It is notably different to look for the oil that they are using when they're frying their products. And usually trans fat are the result of adding of butter and margarine in a bakery products that you are seeing at the right upper side. Of course, that includes the cookies and even the corn chips and the cakes that seems to be so rich in taste and desirable. And together with the favorite foods that the comfort food that busy people are always craving for. Now, the problem with trans fat is that when you go on a usual routine diet and having this excessive trans fat, is that it may lead to a serious health problem of cardiovascular in nature, or even a diabetes. Or worst is that you may have obesity. Now, let's take a look at the omega-3 fatty acid. Now, omega-3 fatty acid is so called as omega. Omega is, for all we know, this is the last letter of the Greek alphabet. The omega is the end. And we're looking here at the carbon of the last carbon of the hydrocarbon chain. where omega is at the end. And you may notice here that in a long chain, by looking at the side chain, second from top to the second, to where the arrow is pointing, you will count from 1 carbon to 2 to 3 where the arrow is pointed. At every end of that wave or line, there is a carbon. And it happened that at the third carbon, there is a double bonding of C to C carbon. And it happens at the third carbon. That's why it's so called as the omega-3. And that is the logic why they called it omega-3 fatty acid. And at the second example down below on omega-6 polyunsaturated fatty acids, you may notice that you will count from the point end of each wave. That is 1, 2, 3, 4, 5. That's the number of carbons. And at the 6th carbon, there happened to be a double bonding of a C to C. And that is omega-6 from the end to 6. That's why it's so called as the omega-6 polyunsaturated fatty acid. Now, omega-3 fatty acid is a desirable fatty acid or a good fatty acid as compared with the trans fatty, which is the undesirable. This may emanate from sources such as the fish rather than the animal meat. And of course, the natural foods like the vegetable and the fruits, right down at the right lower portion. Now, by looking at this situation, as a nurses, we must be aware that we should be knowledgeable as to what would be the lipid profile of our patient. We should be able to at least interpret what is the meaning of these figures and values. Now, our focus here would be on the HDL and the LDL. HDL is high density lipoprotein, which is said to be a good cholesterol, and the LDL is the low density lipoprotein cholesterol, which is known to be the bad cholesterol, and that they are always being compared as to cholesterol HDL ratio, which is a desirable value of 4.0 and at the high risk of 6.0. Notably, what you should be aware of and what you should spot is the value of the LDL, which is the bad cholesterol. We should inform our patient and our client and the doctors that there is an undesirable values that we have to report and we have to take note of, because this may lead to a disease of cardiovascular origin, and that in particular is the formation of what we call the atherosclerosis. Now, if you may look at the video at the upper left, you may see that this is a coronary arteries that is having a plaque deposit. And this may build up over time and may cause sclerosis or narrowing until it impedes the blood going to the heart, until the heart will cause ischemia, an impending coronary artery disease, to leading to myocardial infarction, what we call the heart attack. However, on the lighter side of the story, if we ought to choose healthy foods, okay, and we move our ass from that couch and we work it out, exercise, that would be a good healthy habits for our patient. And as a nurse, may our lesson from our learning from biochemistry be a powerful tool for us to influence our patient in health promotion and as well in disease prevention. That is via our health teaching. We have to remind our client that we are what we eat and we are the choices that we make. And Wigmore once mentioned that the food we eat can either be a powerful or a safest medicine that we can have, or it can be the slowest form of poison that we may take. Now, let's talk about the type of steroids. And on top of the list is the cholesterol. Cholesterol is the key component of the cell membrane. And we have discussed that in cell membrane structure. Other than that, cholesterol is the raw material for the steroid synthesis. And that is when making adrenocorticoids and sex hormones, cholesterol is necessary. Now, cholesterol resembles a rounded and ball structure as this. And cholesterol is being made up of protein, phospholipids, and the triglycerides. However, unfortunately, cholesterol is always regarded as, to some, it is a poison. And that is because somehow you develop a feeling of guilt when you indulge in foods that is very rich in cholesterol. And that is a misnomer. Because cholesterol is essential in human biochemistry. Now, this cholesterol is being manufactured and also being regulated in the liver. And they can also be found in the blood. Now, liver is also responsible and primarily responsible for the production of the bile salts. And this bile salt is being made and stored in the gallbladder. And that is in the form of the bile as stored in the gallbladder. And that appears to be greenish yellow in appearance. And of course, this is of importance to metabolism of fats. And it aids in the absorption of fat-soluble, the vitamin A, D, E, K, or what we commonly know, or what we commonly call as the vitamin ADEK. Now, other than the bile salts, liver is also responsible for the lipoproteins production. And the lipoproteins consist of the following. Number one is the VLDL. Other would be the LDL and the HDL. Liver is responsible for the production of all that lipoproteins, with the exception of the chylomicrons, which are being manufactured in the intestine. Now, these lipoproteins, all of these are being found in the core lipids of a molecule that is at the left. The structure of cholesterol, it can be found in that. All of these lipoproteins are transporter and they are carrier. They carry the cholesterol as to where it is being transported. Now, let's talk about HDL, or the high-density lipoprotein. It is regarded as a good cholesterol. But there's a question why. HDL removes the cholesterol from the blood, and it prevents the formation of plaque from the walls of the arteries. Now, the HDL returns back to the liver. This is for the synthesis of bile acid and steroids. And HDL is 33% protein, 30% cholesterol. Let's talk about LDL, or the low-density lipoprotein. It is regarded as a bad cholesterol. And there's a question again of why. This is for the reason that it carries cholesterol to the cell via endocytosis. 25% is protein and 50% cholesterol. Now, let's talk about VLDL, or the very low density lipoprotein. VLDL transports triglycerides, and this is being synthesized in the liver. It soon turns into a LDL later on once the proteins and the phospholipids has been removed, and the chylomicrons. The chylomicrons carry dietary lipids, and it is synthesized in the small intestine, and nothing is said more about the chylomicrons. Now, on top of this, it is always a good idea to know that it is always desirable to have a high level of HDL and a low level of LDL. And we have stated the facts that if LDL is high, then it will result to cholesterolemia. That is a high deposition of cholesterol. And in that case, the cholesterol cannot enter the cell and be metabolized. And we have discussed this in the previous slides as to there will be formation of atherosclerosis or the plaque at the walls of the arteries. And that sooner this is described as coronary artery disease, that there will result to ischemia and sooner the myocardial infarction. And that's why some medications are being given to lessen the LDL. And this is in the form of atorvastatin or Lipitor. This is a familiar drug that sooner or later you will encounter the likes of simvastatin or Socor. And the action of all these are to inhibit the enzyme in the cholesterol synthesis. And one good thing about a premenopausal woman is that at that stage, HDL is high. And that's why, if you may notice, women do have a lesser risk for coronary artery disease as compared to men. Let's focus on the role of steroids as a hormones, particularly as an adrenocorticosteroids and the sex hormones. First, the adrenocorticosteroids. From the word itself, the adrenocorticosteroids originates from the adrenal glands, which sits on top of its kidneys. And the word corticosteroid meaning there is that part of the adrenal cords, the cortex layer, where the mineralocorticoids and the glucocorticoids originates. Now, the steroid plays a role as mineralocorticoids, either glucocorticoids. If it is a mineralocorticoids, then this is responsible for the regulation of sodium and potassium. And the important mineralocorticoids, which is the aldosterone, is responsible for the reabsorption of sodium and chloride. That means this regulates the fluid of the body together with the electrolytes and together with the blood pressure. And the glucocorticoids is responsible for the regulation of carbohydrates metabolism. That cortisol is an important glucocorticoids. This is actually the major glucocorticoids, and this is responsible for increase in glucose and glycogen. And in metabolism, the cortisol will dictate that if there is a depletion of glucose and glycogen, based on our discussion in carbohydrates, then the cortisol will dictate that the energy be taken from the fat source. And also, cortisol is responsible as an anti-inflammatory agent. Now, let's focus on the sex hormones. The role of steroids as a sex hormones. As the steroids as a sex hormones is responsible for the production of testosterone and estradiol, or the estrogen and progesterone for a female. Now, for the male, this testosterone is being produced by the testes. And the testosterone is the primary hormones of puberty. For when we say in puberty, that's an adolescent stage. It is primarily responsible for the growth of the genital organs, and that the secondary male sexual characteristic is being given emphasis here by the testosterone, such as a deep voice, the facial and the body hair. Excuse me. That is the onset of a deep voice for an adolescent. Now, for the female, estradiol, or this is the precursor of estrogen. This originates from the ovary of a female. This is responsible for the regulation of menstrual cycle, and the ovaries and the uterus are all involved in this process. And the luteinizing hormones triggers the ovulation. All of these are assumed by the steroids as a role in adrenocorticosteroids and the sex hormones. Once again, we have reached the end of discussion. Let us assess and check your comprehension. You may pause the video for a good glance. Enjoy studying, and I hope this material is of help. All the best to you. That's all, folks. This has been your Nurse Radiologico Guru saying thank you for watching and enjoy studying.